diabetes sometimes presents as a vision problem. Many persons, before even knowing that they have diabetes, present with a sudden blurring of vision, which they actually wake up with. And this is caused by the lens of the eye retaining excess water due to the elevated levels of sugar. This form of sugar is called sorbitol, and it pulls water to itself, kind of like osmosis that you learn in school. So when they come in for an examination, you find that all of a sudden they're farsighted, or they have some problem with focusing, changing their focus. And when you check the blood sugar level, it's high. So it's very, very important, even from the initial stage, to have your eye examination, and certainly to track the progress of diabetes and the effect of diabetes on the rest of the body. Eye examination is important because in the eye, particularly in the retina, where the doctor can actually visualize the small blood vessels and see the early changes, the weak areas, the outpocketings, the hemorrhage, the leaks that happen from these blood vessels, then you can actually not only date diabetes, but you can predict the other organ effects that diabetes can have. Diabetics should, upon being diagnosed with diabetes, be sent by the general practitioner, or if the patient is aware, should go to an eye care professional, an optometrist. If it's not an optometrist, certainly an ophthalmologist can be a first call. The optometrist, on seeing the eye problem presenting itself, will send you to the ophthalmologist, who is a medical doctor trained and specialized in eye care. And this eye care ranges from the medical side, where drops and sometimes laser can be used, to the surgical side, where sometimes we need to do surgical intervention to save sight. Otherwise, we try through the Ophthalmological Society of Jamaica to educate general practitioners on the basic use of the ophthalmoscope. The ophthalmoscope is a small device that is used to look through the pupil at the back of the eye to see events happening in the retina. And once the general practitioner picks up that something is wrong, either in the patient's vision or he sees something odd that should not be there in the back of the eye, definitely he can refer. Otherwise, a diabetic should, after 5 years of knowing that you have diabetes, certainly start an annual visit to the eye doctor automatically, even without being referred. And this automatic visit should be done to the ophthalmologist.